United States, in this video, each year in the United States, an approximated 3 million cases of erectile dysfunction are diagnosed. While it is not a deadly disease, erectile dysfunction has serious, negative effects on men's mental health, confidence, interpersonal relationships, and overall quality of life. Contrary to popular belief, it is not a condition that only affects older men. In this video, we will discuss the symptoms, causes, self-diagnosis test, preventative measures, and treatments for erectile dysfunction. What is erectile dysfunction? In the most general sense, erectile dysfunction describes the inability to achieve or maintain an erection. Because there are numerous factors that cause or contribute to erectile dysfunction, it is not a disease, but rather a condition. While a disease might be pinned down to one source, ED can be the result of various influences that might be physiological or psychological in origin. Symptoms of erectile dysfunction. Despite the complex web of underlying issues that cause ED, the symptoms are relatively simple. Difficulty achieving an erection. Difficulty maintaining an erection. Diminished sexual desire. It should be noted that these symptoms must be persistent in order to be considered ED. It is not uncommon for men to experience occasional ED, but when the symptoms are ongoing, they are signs of a much larger problem. Causes of erectile dysfunction. The physical causes of ED often are related to the restriction of blood flow to the penis, which prevents an erection. Any physical factor that restricts blood flow to the penis can prevent an erection. Common physical causes include pornography use, diabetes, heart disease, high blood pressure, high cholesterol, metabolic syndrome, multiple sclerosis, obesity, Parkinson's disease, sleep disorders. Some of the physical factors that lead to it also can be the result of lifestyle choices. Common lifestyle choices that can result in it include alcoholism, drug/substance abuse, recreational and prescription drugs, heavy tobacco use. In addition to these various physiological causes of it, psychological factors can heavily influence one's ability to become or to stay erect. Some common psychological factors include anxiety, depression, fear of intimacy, stress. Erectile dysfunction is sometimes confused with other issues related to the penis. For instance, many people confuse ED with poor libido, but this is a misconception. Lower libido is scientifically understood as lower levels of testosterone, which is produced in the testicles. It simply means he doesn't want to have sex. A man afflicted with ED might still desire sex. It is his inability to get an erection that signals he has ED. Erectile dysfunction affects men worldwide. In the US alone, an estimated 18 million men over the age of 20 are affected by ED. According to several reports, 40% of men between the ages of 40 and 70 are afflicted by ED. How to detect ED? If you suspect you may have ED, it is possible to administer a low-cost self-diagnosis at home before spending the money on going to a doctor for a more thorough medical diagnosis. The first way to detect whether or not one has ED does not even require a test. Instead, if you know that you can attain and maintain an erection, then you safely presume that you are not afflicted by ED. If you are not able to get or keep a persistent erection, then the self-diagnosis test can be performed at home. Treatments for erectile dysfunction. If you are afflicted with ED, it is almost never too late to address the issue and get back to being a sexually active man. There are a number of treatments for it on the market that range from benign supplements with questionable efficacy to invasive medical procedures that require a large investment. In order of least to most invasive, the treatments for it include exercise, herbal, alternative medicines, oral medication, penis injection medication, penis pumps, penile surgical treatment, The least invasive method of treating for ED that has been shown to have solid success rates is regular exercise. The researchers concluded that midlife changes may be too late for smoking, alcohol, and obesity, but switching to an active lifestyle, even in midlife, might reduce the risk of ED. Get the proven, permanent and all-natural cure for erectile dysfunction. Please click the link in the description below to learn more. Thanks for watching.